water consumption and hygiene behaviors in Zambian communities. Sarah?
Good afternoon, everyone. Very happy to be here to talk with you about our study. As mentioned, looking at domestic water consumption and hygiene in Zambia. I am a research fellow at the London School of Hygiene and Tropical Medicine, and this work was a collaboration between the London School and the Centre for Infectious Disease Research in Zambia. So firstly, when we talk about progress on water services, that's often in terms of the type of water source, whether it's improved, its location in relation to the households, and also the continuity of services. There remains limited data on how these different water source types influence the actual quantities of water that's consumed by the households. This is advancing on its own. And also limited data on use of water for health protective behaviours, including hygiene. One important note is that this research was done in 2024 in a period of widespread drought across Zambia. We've discussed at this conference in various sessions that climate hazards such as droughts are now affecting the quantities of water that households have access to, their experience of water insecurity, and how well they're able to prioritise that water for hygiene. And yeah, that's just very true in this context, and you'll probably see through the results as well. So we conducted a cross-sectional study taking a sample of 96 households from each of 3 different areas: a middle-income peri-urban area, a low-income peri-urban area, and a rural area in Zambia. And we interviewed one respondent who had the most knowledge about household water collection and use. And we asked households to bring out all of their containers that they used for water collection and for water storage. And from those we estimated the volume, as well as the number of times they filled those containers or refilled those containers yesterday. And then we went through a quite extensive, laborious process to estimate the quantity of water that they used in the previous day as well, to calculate our sort of most robust measurements of the per capita daily amount of water collected, amount of water used from the stored water in the household, and also for households that are using water at the source itself, how much water they used directly at the source. And one of the first findings was that it was not very straightforward to determine what was the primary water source. There was a lot of kind of heterogeneity in the sources that were being accessed. 80% of households used more than one source, and these were used kind of routinely throughout the year. There wasn't really a clear one source used in a particular season, and households used up to 5 different sources in some cases. But when we did ask them to kind of choose which of these was their primary water source, this did tend to vary by these different regions. In the middle-income peri-urban area, a lot of the households used on-premises piped water sources. Almost always this involved some kind of payment, with a median monthly payment of 100 kwacha. In rural areas, households most often used an off-premises source as their primary source, which sometimes involved payment, and then other times they've used an on-premises source that was not piped. Low-income peri-urban areas used kind of a mixture of these different kinds of sources. So we looked at the quantity of water that was collected and used, and for lots of our indicators, the quantities collected and used were fairly low, although the data were very skewed, so there are some households who used larger quantities of water, and kind of what we'd expect would be sufficient to meet all needs. Looking at the water collected, the households who relied on a piped water source to their dwelling or plot, in pink in the diagram, you collected slightly less water on average than other households, about 8 litres compared to 13 or 14 litres, but then they tended to use more water when factoring in water that was used directly at the source rather than collected and stored. And then when looking at the kind of specific purposes that households reported using water for, in terms of quantities, water use for drinking and for hygiene was very low, and this didn't seem to vary by the type of water, source that was reported as their main source, perhaps reflective of this period of drought when households were really unable to prioritise water for hygiene, no matter what kind of source they were using. So those results might be somewhat surprising. We expect that having a water source located very close to the home, especially if it's a piped network, would result in greater water consumption. In 1987, Cairncross describes this expected relationship between source distance and consumption, with households with a water source kind of within a few minutes of their household consuming much greater quantities of water, and households with a water source further than that using sort of constant levels of water. When we looked at data from our study, we saw a more or less kind of flat level of consumption depending on the distance from the source. And this held true for when this was restricted to just the rural areas or just the peri-urban areas as well. So why might that be? Looking back at our primary water sources, we saw that those using that on-premises piped service had kind of similar levels of water insecurity as measured using the HY scale as compared to households with an off-premises source. But they actually were reporting the greater times of when the water was unavailable in the past month, so discontinuity of services and disruptions. 55% of households reported that being an issue. And because of that, they had to supplement their water with a greater variety of other sources on average. And those other sources that they supplemented water with were most often off-premises sources, so they then had to travel outside of their home. So it seemed that that's kind of water collection patterns might be shifting in response to service disruptions. So we investigated this further using path analysis or structural equation modelling. We were looking at a few factors that might affect water collection and use at the source, and I've put some of them up there from a sort of initial, quite complicated model to try and predict the volume that was collected or used at the source. So roughly how much water water collectors getting when they're reaching the source. And we looked at some direct and indirect pathways. I'm not going to go into all of the details of the model estimation process, but I'm going to talk about a few kind of interesting coefficients. And we also looked at whether our data were kind of grouped, so whether a different structural model best fit the data when we were looking at various groupings, and we found that there were two distinct models for whether the source was on premises or whether it was off premises. So I'm going to talk about those two models. So looking just at the off-premises sources, we found that the capacity of water collection containers was significantly positively associated with the volumes of water that were collected. And we also found a kind of negative direct relationship between service disruptions and the volume that was collected, but also when there were periods of disruptions, households tended to take more trips to collect water, and so this kind of reduced this variable in magnitude so that the total effect was lower. And we kind of hypothesized that this was a sort of mitigation behaviour, that households travelling to collect water had to take more trips in these times of when it was unavailable, and this obviously places more burden on those households as well. And then looking at the on-premises sources, again I won't go into all of the details, but we found that higher monthly payments for water were associated with less water collected. And then we also found this slightly confusing positive relationship between service disruptions and the water collected. And we don't really have an explanation for this, but it's possible that households are kind of collecting and storing more water in response to periods of uncertainty with the water sources. But unfortunately, this is kind of a single cross-sectional time point, so it's hard to tease out those relationships more. So yeah, in conclusion, understanding that this was a cross-sectional survey, and in this period of extreme drought, we found quite complex relationships between water sources and water consumption in this domestic context, and there was quite a lot of source heterogeneity that we weren't expecting. We found that on-premises pipe services are not a guaranteed higher level of service in the study communities. Actually, these were associated with greater kind of insecurity, as well as needing to kind of supplement water with other water sources. We found that although the quantity of water consumed was quite similar between these sources, it's possible that some of the factors that determine how much water can be collected, stored and later used does differ by the different type of sources, and these factors and possible kind of mitigating behaviours in periods of disruption should be explored in further work. I want to thank the amazing team at CIDERS who are pictured here, and the funding from the UK FCDO. Thank you very much.
Thank you, Sarah. Any questions or clarifications?
When you were showing your diagram of how everything's connected, was that meant to just show how confusing it can be, and it was like a visual or of that, or was it, no, there was an equation behind that formed it?
Yeah, the path models, yes. Sorry, I had to speed through this because there's not much time. But yeah, so we started, we're kind of building a model to best explain how these different factors relate to each other. We did go through a process of starting with this more complicated model, and the way this is estimated is it's essentially like a series of simultaneous regression analyses. So each of those coefficients will be from a regression analysis that's linking the two kind of nodes in the pathway. We did try and reduce some of those pathways down. Obviously some of the factors are not relevant, so for the on-premises source we don't have this variable of distance to the water source involved in the model, but it's still a rather complex model because of how we estimated it. Yeah.
That was cool.
Thank you. Any other question for Sarah? Sarah, did you look at the crowding? Where they fetch the water, whether it was crowding there and if it has any effect?
At the water source itself? Yeah, I don't think we have that variable. We do have sort of household crowding and how many people were using the source if it was in the household itself, but not at the source. But that's definitely something we could explore in a later survey.
Okay. Thank you.
Thank you so much.
Is there another question?
It's not, I'll ask her.
Thank you.
Okay, so I am going to take you now from Zambia to the United States in the Southwest. We're going to be talking today about the Navajo Nation, and actually, Sarah, you mentioned it a little bit, the HY scale, the Household Water Insecurity Scale. We're going to actually take that scale and apply it to a population, to an indigenous population here in the United States. And hopefully these slides will work. Awesome. Okay, so the title of my presentation today is Measuring Water Insecurity on the Navajo Nation using a representative household survey. And my name is Natalie Exum. I'm an assistant professor at the Bloomberg School of Public Health at Johns Hopkins. And I'm also representing my amazing team here from the Center of Indigenous Health. A large group of people went into this work. And before we do any presentation of our data, we just wanted to acknowledge the land upon which we work. This is for where we work here at Johns Hopkins in Maryland, just to say that we honor the Piscataway and the Susquehannock nations, the original peoples of the land which Johns Hopkins University occupies, and we give thanks to the past, present, and future stewards of this land and respect all the tribal nation sovereignty and right to self-determination. And we hold ourselves and the university community accountable to tribal nations, and together we acknowledge the history of genocide and ongoing systemic inequities while respecting the treaties made on this territory as a step towards reconciliation and strengthening relationships with indigenous peoples. And just important to take a moment there and just to say I have no actual or conflicts of interest here as I'm sharing this data with you. So today I'm going to talk to you a little bit about the Center for Indigenous Health, the work they do, and how that has really informed the way we're approaching this household water work, and then really diving into one piece of the larger study that we've been doing just to talk about household water insecurity and applying a scale that's been used across the world to the United States and in a indigenous population there. And then what you all have been waiting for the results. So just to briefly go into the Center for Indigenous Health, it has offices across the United States and on the Navajo Nation. There's 4 offices actually there, and we employ over 80% of the staff are Navajo themselves. But actually, the center was founded in 1991 on the Navajo Nation, actually for diarrheal illness. And so Matu, Dr. Santosham, started when he saw that all this infectious disease happening on the reservation, and actually oral rehydration salts were innovated with a lot of the Navajo population, the White Mountain Apache population, and was part of that real revolution so that these children were no longer dying from diarrheal diseases. The center focuses on strengths-based, culture-based, evidence-based approaches. We promote tribal sovereignty. We like to demonstrate impact, and we actually do something where our teams have, our PIs are part of the community, so we have a pact with the Navajo Nation themselves that any research we do, I myself as a principal investigator am partnered with an indigenous PI on the reservation themselves to ensure that the work that we're doing is in line with what the tribe would want. And so I guess that's what I said. Our mission there is to work in partnership with communities to advance indigenous well-being and health and leadership to the highest level. Okay, so just briefly, water access on the Navajo Nation. Water in Navajo Te'e'ena. Water is life, it is sacred, it is part of the Dene culture right. We talked about land and water rights are fundamental, and they're deeply integrated even into clan names and community identities. So despite that, there really is the reason for this work in the beginning is that we did not even know who has access and who doesn't have access. The tribe would be telling us 40% of our population does not have access, and then we'd be hearing from government entities, I'm being generous by saying 15. Sometimes they would say only 6% of homes. And so it was a real moment to say, we do not know what's happening in terms of water in this very large, it's one of the largest by landmass indigenous tribes in the United States. So many families rely on water hauling. It's become part of the culture. There's a lot of water quality concerns. There's a lot of historic legacy mining contamination. So a lot of people have been concerned with that. And then anyone there will tell you the mega drought is just an ongoing challenge. Dropping water tables and water scarcity is just exacerbated. So here we are with the Dene Household Water Survey. This is the work I'm going to tell you about at large, and then I'll go into a little piece of the survey as we talk about household water insecurity. But the main goal of this study was to understand really that statistic that I was telling you about. And so we designed a random sample to get a representative estimate truly of what the situation is out there. Can tell you a lot more about that after this. I'm worried about the signs that are going to get posted soon. So we'll just share that in order to get this representative estimate, you have to really know where people live. You have to be able to sample a full list of homes. And so there's a lot of community buy-in to be able to do this work. And this work is long and hard, and you have to get approvals from all levels of government, it's a remarkable process that our team at the Center for Indigenous Health is extremely well equipped. And the relationships that they've built with the Navajo Nation government over the decades has allowed us to go in and do this work. So just to note that this happens over years to be able to get that permission. And a lot of the work that we did was community driven. This was kind of post-pandemic, but still, these kind of community markets where we were piloting a lot of the questions to ask, are we really getting at the water situation correctly? This community mapping piece was crucial because there were no maps to know where people lived. This is a longer story, but just to say that we really had, we used aerial imagery, we were using people from the communities themselves to help identify every single home. We then took those pins to the chapter house to say, is this a home, is this not a home? And then, so there's a lot of validation going on to ensure that the randomly selected homes were truly a comprehensive list, so we can say this is a representative estimate. And so lots of different aspects to this survey, lots of different pieces. If you have a pipe connection, it can be a quick hello and goodbye, but if you have a lot of different water sources, we're going to be there talking to you for longer. And it was also offered in Navajo by our Navajo speaking team. Okay, so just to briefly say, this piece of work I'm going to talk to you about just from this one Fort Defiance agency. There's 5 agencies. We've recently expanded this work to the Chinle agency. That data just came in. We also did kind of a sub-sampling to get drinking water quality tests from homes. We test for a lot of different contaminants. That data I won't share with you today. Stay tuned for that later. But let's get into the findings mostly from that work, and then we can dive into age-wise. So we found basically that 1 in 4 homes don't have a pipe. Okay, so 1 in 4 homes has to water haul in some level, but the water hauling is kind of embedded in the community, and so you'll see there, about 41% of the population is saying that they water haul. If they water haul, we added up all of the, we're working in gallons now, we really should do this in liters for our international audience, but about 70, so 73, so most of the population is using about 13 gallons, so, about 50 liters per capita per day, right? So right around where that level of health and dignity standard is. And despite if you had a pipe or not had a pipe, 75%, 72% of the population is drinking bottled water. There's extreme distrust in the quality of the water that's coming out of any pipe. And so people have come to believe that bottled water is the safest option. And I'm not going to share the kind of financial data with you, but that is a cost that these families cannot incur. And often they're choosing between food or water if they're going to the store to go buy, to go purchase things for their family. So top concerns: the roads are really poor quality. Do you need a car to be able to do this work? The cost of water is extremely high as it is when you're adding up all of these maintenance costs for all the wear and tear on your vehicle as you've got a 1,000-gallon drum that you're driving to your house. And people want water lines. Navajo Nation is very spread out, but people really want a line to their home, and people really want roads to be able to travel to get to their homes. And also there's a lot of water points around the Navajo Nation that people actually utilize and want more of. And so really it's more water, right? Like just quantity-wise, just more water. So setting the stage there, now we're going to dive into this idea of water insecurity. And water insecurity is a term that gets used a lot, but we really wanted to apply the scale that's been used on that international level to this tribal context in a high-income country. And so just briefly, if you're not familiar with age-wise, it's a 12-question survey that was validated across the world, and it has a scoring system such that you are considered water insecure if you are at this 12, if you end up scoring 12 or higher, okay? And it's great, right? Because we can compare a community in Bangladesh to the community that you just shared about in Zambia, right? So it's a really neat scale, and we wanted to see, can we use this and apply this on the Navajo Nation? So we made some adjustments. We had done some pilot work before to know, like this kind of rarely, sometimes, often, always wasn't working for our population, so we made it into days. One thing that we knew wasn't going to work was this idea of usable and drinkable being together, because, you know, those two uses of water is so radically different in our Navajo Nation and the Navajo Nation's, you know, mind. So we ended up separating those two questions. And then laundry and clothes, we added in an option for, instead of saying not applicable or I don't have this, we added an option for that they're not washing them at home. But still to mention, we still use that as missing in our analysis. So we'll talk to you about how we dealt with that for this population. And just to be transparent about the scoring, it really did, oh, it was 2 minutes? Is that 2 minutes? Okay. It really did align with the way that the HY score was working. So we had a lot of missing for this closed variable. So I just wanted to share that we ended up taking out that variable completely. And you know, the overall proportion of water insecure households didn't change that much, but we wanted to keep our sample size as large as possible. So when we use the classic HY score, we get to 6.6%, 7% water insecure, which we were like, we know that's not the case, okay? So why is this not working for the Navajo Nation? So we ended up, we know it's an underreport, we ended up revising this to say, which actually we're not the first ones to do this, others have revised the HY score to now say, okay, it's not going to be 12 or greater. It's going to be, if you have any one of these questions that you're saying you're doing, you know, sometimes we're going to score that as a 1, okay? So that did increase the proportion of homes that we now are saying are water insecure to something that we are more comfortable with knowing this population, that it's now at about 43% of homes are water insecure. And just to share kind of a stratification across other important water variables to see, you know, does this make sense? Is this scale working? And yes, right? If you look to see, if you do not have a pipe on Navajo Nation, you're 73% of those people are saying that they're water insecure. And that number is only a third for people who do have a pipe, right? Another good example here is if you're having to bathe, right? So a lot of people, if you don't have a pipe to your home, you know, you're using a basin in your kitchen sink to wash your hair. But if you really want to take a shower or bathe, you're going somewhere else. So we're really, so we do see that this kind of adjusted HY score is working on that for the Navajo Nation. I wanted to just demonstrate here, not just are you water insecure, not water insecure, but the severity of your score. And so you can see the piped homes that are considered water insecure have kind of low scores, right? They're all kind of, they're skewed left. It's you know, there's very few that are in that more severe category of higher numbers. But when you go to the homes that don't have pipes, you see that it's a little bit more distributed and that there's more severe water insecurity. And so these are just some preliminary findings. We're beginning to unpack this a little bit more and hope to have something out this year to share. But just to say, the original HY's tool needed some adjustments to be more reflective of the Navajo water insecure situation. Navajo water, HY is considered the household as a water insecure if it reports experiencing at least one of these 13 challenges. And when we did make these adjustments, it really changed the situation from 6.8% to 43.4% water insecure. And right, this difference between piped and unpiped really is drastic. And so at the end of the day, people are saying, I want a water line, and our data are showing how that could really stop and how that could really be effective. So thank you. I wanted to just say a huge gratitude to Osprey Foundation, who really led this work and believed in this work before anyone else did. And Dig Deep has also been a great funder as well. So thank you guys so much.
Thank you for the nice presentation. Any question? Yes.
Thank you, Natalie, for such an interesting presentation. I understand that this is a specific context that you make these adjustments. The first question was, I don't understand the difference between usable and drinkable, and I wonder if that was confusing to people or if that's some terminology they use that is used and understood. And I guess the other is, like, how far relaxed was your adjustment for the 1 out of 13, but like the normal HY scales is that 6 out of 13? Like, how much adjustment was made?
Yeah, thank you for both of those questions. Usable and drinkable is completely comprehensible for the Navajo context because at this point, basically bottled water is only what people are drinking. And so, maybe people would be cooking with it, but actually people feel pretty safe cooking with the water that comes out of their tap. It's just this drinking, and that is really this historic trauma of people saying, this has been contaminated from arsenic or uranium or whatever it is. They've gotten that message. And so, in the recent past, our team would say in the past 10 to 15 years, they've really seen the population just now say the only safe thing to drink is bottled water. And then this relaxing that standard from 12 down to 0. This has actually been done in some other work for the HY scale, so we felt comfortable doing it and just allowing that heterogeneity to be a little bit more transparent, to then say, it's not something that we're still trying to understand in this work that I don't feel comfortable enough putting in a slide or sharing, is that there's a tendency to not want to say, to say everything's fine, right? And to not want, your situation is your situation, it's been your family situation forever. And so to say, so there's a little bit of bias towards like saying everything's fine. So if one person says, I go to bed worried at night that I'm, or I'm angry at night, that's saying a lot. And so we feel pretty comfortable saying you're water insecure if you're going to acknowledge that emotion. Yeah.
Thank you.
Thank you.
Very good. We're going to take our third presentation, looking at intermittency.
Okay, hi everyone. My name is Niven, and today I will be discussing associations between water supply intermittencies and water use, quality, and health outcomes in peri-urban Malawi. So as it's been a topic of discussion this week, billions of people still lack safely managed drinking water at home. Safely managed being on the premises, free of contamination, and reliably available. Over 1 billion people rely on an intermittent piped water supply, and that's characterized by irregular or unpredictable access. So this irregular access can really drive water insecurity, which is a broader concept that captures the impacts of these water interruptions as well as potential health risks. So during periods of stagnation or low pressure, pathogens or contaminants may intrude into water systems. Households may store water for longer periods or turn to unsafe sources. And they may have limited access to hand hygiene or hygiene opportunities such as washing hands and bathing because of needing to ration the water supply. So water supply disruptions may also increase the risk of enteric and respiratory infections, as households may have greater exposures to contaminated water and limited abilities to maintain hygiene. Around 70% of diarrheal diseases in low and middle income countries are viral, yet antibiotics are frequently used. And this misuse can really contribute to environmental loading as well as antimicrobial resistance. An intermittent water supply may also affect mental and emotional well-being. Chronic stress and anxiety are common, especially among women and caregivers. And overall, we can, especially those who have to manage a water supply. So overall, we're seeing that an intermittent water supply isn't just a technical issue. So knowing that, we aimed to understand how an intermittent water supply can affect health across multiple pathways. So research on water intermittency is growing. Most studies are focusing on a single aspect of this, such as quality or infrastructure limitations. So this study is really taking a comprehensive approach to examine the physical and mental health outcomes. We're also focusing on Malawi. It's a landlocked country where half the population lives in poverty, 1 in 5 lack clean drinking water, and over 2/3 experience some form of insecurity, water insecurity, which makes it a really critical setting for studying these impacts. So building on that motivation, the goal of this study is to investigate how an intermittent water supply affects water use, water quality, child health, and caregiver stress in Malawi. So to better understand these challenges, our study focused on peri-urban neighborhoods in Blantyre, which is a region where growth and infrastructure can make water access quite unreliable. We gathered survey data and environmental samples from households within informal settlements in Bangwe, and then all data were collected using a structured quantitative questionnaire. So now I'm going to follow water intermittency down the causal chain using a directed acyclic graph. This is a visual representation of causal relationships. So starting on the left, we have our primary exposure, and then on the right are outcomes, and then all the variables that lay in between the two are called mediators, and these are things that we know can influence our outcomes. So starting with our primary exposure, which is water intermittency. We measured this using 2 survey questions from the validated HY scale, as Natalie just talked about, and this is a tool that's widely used to assess household water access. And so these questions captured how often households experienced interruptions, as well as how long the most recent interruption lasted. And so from those questions, we created 3 exposures, which were occurrence, frequency, and duration. And so that allowed us to explore the regularity as well as severity of disruptions. So we also collected data along the mediating pathways, but for the sake of this presentation, I'm not going to go into detail on them, but I do want to highlight them as we are moving down the causal pathway. So next is stored water quality from the samples that were collected from our study households. We used IDEX Quantitre 2000 to quantify the E. coli, and then to assess antibiotic resistance, we supplemented our samples with cefotaxime. So moving on to the health outcomes, we used a 7-day recall period in order to capture the most recent health events and to minimize recall bias. So starting with diarrhea in children under 5, to measure this, we used 2 previously validated questions that targeted different definitions of diarrhea. So one was looking at the respondent's perception of diarrhea, or what constitutes as illness, and then the second uses the WHO's definition. Next, we looked at acute respiratory illness, or ARI, in children under 5. There's no one clear way to really define an ARI, so we are using 4 previously validated questions that look at different symptoms associated with them. So persistent cough, congestion, panting, wheezing, and then fever alone was not indicative of a case, but could be used in conjunction with any of the others to identify more severe cases. Next, we're looking at antibiotic use, which is an important behavior that's associated with our health outcomes. So caregivers reported the number of times the child took antibiotics, and then we created 2 variables, binary prevalence, as well as the continuous frequency of use. And then we also included 2 negative control outcomes. These are theoretically causally independent of water intermittency, and these were skin rash and ear infection. And then the last of our measured outcomes, I promise, is caregiver reported emotional stress. And so this was measured using the perceived stress scale, which is another widely used and validated tool, with 10 Likert scale questions that ask how often participants felt certain ways over the last 4 weeks. And scores range from 0 to 40, with higher scores indicating greater stress. And so from these, we generated a continuous composite PSS score and a binary high stress variable. Okay, now onto the meat. So we're talking about statistical methods. I used regression modeling in R to assess the relationship between water intermittency and our 5 primary outcomes. And then we implemented robust standard errors to account for geospatial clustering and controlled for relevant confounding covariates. So onto the findings. About 1/3 of households experienced at least 1 intermittency in the past 4 weeks. And in terms of duration, the average length was about 4.5 days, but there was quite a wide range. And then among the households that experienced at least 1 intermittency, most were caught off guard. So about 84% were unaware that the interruption was going to happen. So that level of unpredictability can really add another dimension of stress. Moving on to water quality, we found that about 66% of our samples contained E. coli, and a little over 8% contained cefotaxime-resistant E. coli. But because we had so few samples positive for AMR, we could not assess associations with our exposures, but overall we did find that water quality really didn't differ significantly regardless of intermittency status. So now I want to highlight some differences in water intermittency and use behaviors. So I'm going to note the similarities in green and differences in red. So households with intermittencies had higher mean HY scores, which indicated greater water-related stress and insecurity. And about 21% of these households met the threshold for being water insecure, similar to what Natalie was talking about at that 12 range. And then both groups reported similarly high hand washing after defecation and handling child waste, which would suggest that these key hygiene moments are well recognized. but intermittent households were less likely to wash their hands after handling animals or working, which are activities that increase exposure risk. They were also more likely to skip washing clothes, bathing, and hand washing after dirty tasks, which could reflect the trade-offs when water isn't available. And so overall, these findings really show that intermittency not only affects just access to water, but also the ability to maintain consistent hygiene. Moving on to child health outcomes, in terms of general prevalences across the two groups, children in intermittent households had higher prevalences of all health outcomes compared to the non-intermittent households. So I'm gonna explain the results using forest plot. Left-hand y-axis are our health outcomes. Each dot is an adjusted prevalence ratio. Horizontal lines are 95% confidence intervals. If the confidence interval crosses the null dotted line, then it suggests there was no significant difference between the groups. So for child health, we see an intermittent supply was associated with an 85% higher prevalence in caregiver-defined diarrhea. And though not significant, WHO-defined diarrhea followed a similar pattern. It was also associated with almost 2 times higher prevalence of ARI with fever, and then a similarly increased prevalence in ARI, though not significant. And we did not see any significant differences in antibiotic use. And then once we expanded our analysis to look at the frequency and duration of intermittencies, we saw that short or rare interruptions were more strongly associated with caregiver-defined diarrhea, and then long or frequent interruptions were more closely linked with respiratory infections. And I'm happy to revisit these findings in the Q&A. And then for the sake of time, I'm only going to be discussing the high stress variable for caregiver stress, but I have all the individual indicators on an extra slide if anyone wants to see them. But in general, those experiencing frequent or shorter duration interruptions reported significant high stress scores. And so that could suggest that the unpredictability may be very burdensome. So this study is among one of the first to really comprehensively examine the downstream impacts of a water supply or an intermittent water supply. Our work really builds on a strong theoretical foundation that integrated insights from environmental health, epidemiology, social sciences, and we also conducted robust sensitivity analyses as well as testing alternative model specifications to really ensure the consistency and reliability of our findings. Some important limitations: water intermittencies and outcomes were self-reported, so they are subject to recall bias. And the survey was pretty long, so that may have introduced some respondent fatigue. And we adjusted for many covariates, but it's possible that there is residual confounding. And our negative control health outcomes are imperfect, as hygiene could influence rash and ear infection. Our small sample size may also have limited the precision of the study, and because the exposures and outcomes were measured concurrently, we can't really establish clear temporality. But overall, our findings were consistent, biologically plausible, and unlikely to be due to chance. So in summary, an intermittent water supply isn't just a technical issue, it really affects hygiene, stress, and health. Households with interruptions were more water insecure and were more likely to skip key hygiene behaviors. Children in these homes had nearly twice the prevalence of diarrhea and respiratory infections, which can show how an unreliable supply may translate to real health risks. And caregivers also reported greater stress, particularly with frequent or unpredictable interruptions. So altogether, addressing the issue of water intermittency means we must go beyond looking at infrastructure. So efforts to reduce health impacts should consider a variety of factors, such as improved communications and psychosocial support. So finally, I'd like to take a moment to recognize everyone who organized and facilitated this project in Malawi. And if you're interested, the preprint is available on medRxiv. I promise it's here again. And again, I'm Caitlin Niven, and I appreciate you listening. And if you have any questions, I'm willing to take them.
Thank you so very much.
Well, great presentation, Caitlin. So I want to ask you about the stress.
Sure.
So to what extent did you decouple the stress due to the lack of water with other factors like not having access to electricity or even actually the weather? Because they have 2 seasons and the stress level may change depending on those factors?
Yeah, that's a great question. So that's a bit outside of the scope of this study. However, this study was nested within a larger study looking at food, water, and energy insecurities. So looking at those associations is actually a paper we're coming out with in a little bit. But for the sake of this study, we just focused on stress associated with water. And then, there are individual questions within the stress scale that look at like coping mechanisms and anger and feeling like things are outside of your control. But we can't really associate that with directly to water insecurity because we didn't measure the behaviors associated.
Thank you. Any more? The intermittency, you did mention that 4 days out of.
I can.
Yes.
Oh, 4.5 days for the average.
4.5 days of our period?
Over the course of 4 weeks.
4.5 days over 4 weeks. So 1 day per week. Sort of, okay, thank you. I've seen an intermittency that is far worse than this, so I can imagine what the results will be.
We did have up to 90 days within the last, once the most recent intermittency occurred.
Okay.
Yeah.
Any other question from Natalie? Thank you so very much. Very interesting story. Caroline?
Yes.
Okay, hello everyone. Thank you all for staying for the last presentation. My name is Sear. I am a PhD student at Virginia Tech. This presentation is probably going to be a little bit different from some of the other things you've seen so far this week, but hopefully it's still a little bit interesting, and especially if you are in any education setting, something that you might choose to bring to your own work. And I'd like to thank the National Institute of Health and National Science Foundation for funding some of this research, as well as my advisors, Alistair Cohen and Landon Marston. So, as I'm sure a lot of us have been talking about, environmental issues are often complex, wicked problems that do not have very clear of a solution, and to address these issues really requires the integration of various and often conflicting stakeholder perspectives. Stakeholders like community residents, government leaders, local industries, all might have varying values and priorities, particularly in regards to water resources challenges. And so planners must learn how to effectively engage these stakeholders in order to develop holistic solutions. However, this is a skill that has historically been pretty challenging to teach in the classroom due to constraints on time, resources, and other logistics. And another maybe seemingly unrelated challenge can be seen in the rapid rise of Gen AI, or generative artificial intelligence. And as technological improvements are increasing exponentially, this has become much more prevalent in business and corporation work on the day-to-day. So according to Cengage Group and their 2024 Graduate Employability Report, 73% of employers incorporate Gen AI into their work. However, 55% of graduates feel unprepared or discouraged to use Gen AI, particularly by their professors. Concerns around academic dishonesty or the hindrance of critical thinking skills often lead to hesitancies in embracing Gen AI, but that also leads to a critical knowledge gap between recent graduates and desirable employees. So ChatGPT actually offers an innovative solution that might help address some of these challenges. And a ChatGPT Plus subscription supports the creation of customized generative pre-trained transformers, or GPTs. GPTs can be built to represent a desired persona and will just respond to prompts by the student that is interacting with them as that stakeholder that you can build it to represent, such as the mayor or a utility operator. And GPTs are customized through their instructions, which are written commands that are given on the back end of the customization, as well as the knowledge, which are uploaded documents that provide a base for the GPT to pull from. And so by creating these GPTs, we were able to simulate a stakeholder engagement activity when it comes to water resources challenges. And this leads me to my research goals for this project, which are to identify prompting techniques that improve GPT performance as stakeholders, as well as to develop a reusable and flexible template that can guide instructors in building their own stakeholder engagement assignments. So an initial pilot assignment was given in the spring of 2024 to a water resources planning course. And in that, students were asked to interview 5 simulated stakeholders impacted by water contamination in a rural Appalachian mining town. And they then used what they learned through these interviews and applied that to the planning process in developing possible solutions and looking at alternatives, costs, and benefits. By using their interview transcripts as well as student-reported feedback, that helped guide where we wanted to explore the improvements for this, and that led us to looking for strategies that would help increase stakeholder specificity, improve contextual relevance, and ensure adherence to the interview format for the GPT's response. And so several techniques were investigated to take a look at how to improve these assignments. And so, for example, we found that a structured and organized instruction section that addressed various aspects of the rhetorical situation, such as the context, the subject, and the audience, is really provided a strong contextual understanding of the GPT's role and the assignment. Additionally, we used chain of thought prompting, which is a technique that guides the GPT through intermediate steps in processing, and that allowed us to better dictate the output of the formatting and avoid some of the list formats that came out after the first few iterations. And lastly, we found that for the knowledge documents, by using a combination of both universal documents that brought a cohesion to all of the stakeholder responses, as well as a unique document for each stakeholder, which improved stakeholder specificity and giving stakeholder specific information, especially from their own perspective, if that was possible, really increased the quality of the interviews. And so this knowledge was then used to construct a flexible template that will be available for public use. And after leading the instructor through selecting the learning objectives, the first step asks the creator to select a topic, a scenario, and relevant stakeholders that could be found in that situation. The second part involved sourcing background documents and writing the instructions, and we made sure to clearly differentiate between what was universal between all of the stakeholders and what was stakeholder specific and unique. And lastly, the final step just added some technical guidance on how to assemble the GPTs in the ChatGPT Plus platform. And so to assess this template, it was assigned to a new class of the same water resources planning course, and this time as a 2-part assignment. The first part had students use the template themselves to build stakeholders for a water resources topic of their choice, which they were asked to interview from a variety of different sources. And then the second part had them interacting with the other stakeholders that were created by their peers, and then that allowed them to practice the stakeholder engagement aspect of this project. And survey responses suggested that the assignment effectively addressed both of the desired learning outcomes, which were to improve stakeholder engagement skills as well as improve Gen AI literacy. And prior to this assignment, students reported a very wide range of knowledge and comfort using Gen AI. We used a Likert scale for all of our survey, and for this first question on prior experience, answers were totally split from 1 to 6, and averaged basically in the middle. And as desired, this assignment did help students build confidence in using generative artificial intelligence. So 86 and 73% of students either agreed or strongly agreed that creating and engaging with the GPTs supported their learning in using generative AI respectively. So while interacting with the GPTs can be a good introduction to Gen AI tools, actually building the GPTs really let the students see the back end of the prompting and the construction, and may further enhance Gen AI understanding. Additionally, both creating and engaging with the GPTs effectively taught students how to integrate stakeholder perspectives into the planning process, with 82% of students agreeing or strongly agreeing with this statement. And this is where we like to reiterate that while GPT-stimulated stakeholders are not intended to be used by professionals in actual decision-making situations, they do offer a simulated activity of interactions that many students aren't able to experience otherwise, and will hopefully prepare them for their future careers where they're likely to run into a situation just like this. So some of our limitations: stakeholder GPTs can only be created to the best of the author's knowledge, and so we really encourage thorough research and looking at sources from various perspectives, whether you're looking at journal articles as well as popular news and sources from different perspectives, just to try to reduce those biases, but of course they cannot be eliminated fully. And then again, this activity is really just a classroom learning experience, not a replacement for stakeholder engagement in practice. And so since the development of this template, it has been presented at an engineering education workshop and is currently under review for publication for open access. And if you are interested in this template, feel free to let me know. And thank you guys so much for sticking around today, and I hope that this is something you might consider. Thank you.
Thank you very much.
Yeah.
I'm pretty loud, so it doesn't. Okay. Can you comment on the water cost or the environment? I knew you probably knew someone.
Yeah.
Like the environmental, especially given the subject matter of water.
Yeah. It's
especially if this is widely adopted.
Mm-hmm.
This is going to probably increase the usage of chat. I mean, it's already probably used so much, but the usage of chat GPT, and it's like mandated.
Yeah.
By professors or teachers. So can you comment on that?
Yeah. So we do acknowledge that data centers and any sort of generative artificial intelligence definitely does use a significant amount of water. When you're comparing using maybe ChatGPT to a Google search, it's definitely going to use more water than that. So we want, I guess the way that we see it is compared to the broader picture of sectors like agriculture and industry and manufacturing, electricity, the water usage across the US that goes to something like this is pretty minuscule when comparing. And so I guess we want to focus our reductions on some of those like bigger things. When it comes to artificial intelligence, I think if it's something that using artificial intelligence in this way is something that you can't really do with just a simple Google search, then maybe it's like worth the extra cost. But using ChatGPT for things that can be very easily done elsewhere might not necessarily be as worth it, if that makes sense.
Hi. Thank you for the really interesting presentation. I was curious if you think there's any way to kind of do some quality control or sort of compare with responses of actual stakeholders to make sure it's accurate.
Yeah, that would definitely be a really cool experience to do. I think in our perfect scenario, like, we wouldn't be using ChatGPT, we would just be interviewing everyone and really getting that firsthand experience. This method is usually aimed to be used when a situation like that isn't plausible. I would love to be able to go out and interview like all of my different stakeholders and kind of make sure that it's coming across in a way that they might agree with or not. So no, I haven't been able to do that. I think we really focus on when you're feeding like these knowledge documents as their background to try to find something that would be like written in their perspective. So like when I built like the federal regulator, I got like a federal executive summary document that would be something that would come across their desk. While doing a community member, I'm looking for an article that has lots of quotes of those members saying something. But yeah, I would love to like bring people in and kind of see what they think of it.
Thank you. Any other question? We still have a bit of time. Yes.
Thank you for doing this. I really appreciate it. I build courses for professional training, and we're starting to use AI integrated into the courses. And what I'm wondering is, have you worked at, like, how do you end up using them in the classroom? Are they embedded into, like, is it a link? Like, how are our learners accessing the GPT?
Yeah. So on ChatGPT, if you have an account, you can build these GPTs, and then each GPT has its own associated link. And so really to disseminate it, you just have to give the students, like, I would give them a document that has like 5 links on it, and it would say, this link is the mayor, this link is utility operator. Just click on the link and that brings you directly to that GPT to interact with.
Do they need to have an account?
So to create the GPTs, you do need a ChatGPT Plus account, but to interact with them, you can do that on a free account.
Thank you.
Yeah. And if you're interested in research of an entirely different topic on private well waters, I do have a poster after this, so I'll stop by for that as well.
Thank you so very much. I think all the presenters have done well, and you've all done well, so let's give ourselves a clap. And I think what I picked from this presentation is that integrating the GPTs helps students learn, and then it also helps with the interaction in the classroom, things that you cannot get in the classroom. Previously, for water resource management, you may have to interact with various stakeholders, but this allows some level of interaction in the classroom. What else did I learn? The intermittency. We realized that yes, with those having intermittent water supply, it did affect the quality and it did affect the health. What else? The first one, what was the first one? Help me.
So water consumption in Zambia, cancer source.
Yes, the water consumption in Zambia, I think that was also interesting. It confirmed I came across that as you travel, the further away you are from the source, it affects the consumption. And what else did I learn from there? I can't remember.
Navajo Nation.
43% water insecurity.
Yes, and yes.
Build some water lines for the Navajo Nation. That's
What's the name of the area?
the Navajo Nation. The Navajo.
Navajo Nation. That's the HYs, which was even adjusted, and it still informed us that the water situation was not good. The water insecure. So what are we doing about that?
We need to talk about that next year.
Okay, on this note, I'll say a big thank you to all of you.
Thank you.
Throw in the curveball.
Yeah, it was
Heard that part of your research before.
yeah, it was just a little side project that I did. So.
Oh, okay, that's really good.
Yeah. Yeah, it honestly wasn't meant to be that big of a thing. It was really just, it was like, I was really into it. I was like, well, I need help with this thing. And so like, can you help me put this thing together? I was like, yeah, and now we're writing a paper. So, yay. I don't want that up there anymore.
Amazing. That's my dog.
Are you saying that right now? Yeah.
Are you okay?
Are you going to go stand by my push?
I said, well,
As soon as we started this, I was like, I don't mind the water scarcity one. I'm like, is anybody ever thinking about water? And say, I don't know what to do with water. I always have to prepare for that. And I'm yeah, that's great.
There's always someone. So we work very closely now.
You kind of have that. No, I was like, I was going to talk about any of
Andre.
Because of the kitchen, you know? But yeah, she's a part of it.
I'm just not.
Yeah, I was
yeah.
Oh, yeah.